Sugar addiction. Is it real? How does it work? And what does it mean for our patients and ourselves? Sugar, more than just a sweet tooth. We all know that sugar is everywhere in our coffee, our snacks, our so-called healthy foods. But can we really call it addictive in the same way we talk about substances like nicotine, cocaine, or alcohol? Animal studies say yes. When rats are given access to sugar, they show classic signs of addiction: binging, craving, tolerance, withdrawal, and even cross-sensitization to other drugs. In fact, some studies show that rats will actually choose sugar over cocaine even when they're already addicted to cocaine. That's a pretty powerful reward. But what's happening in the brain? Sugar stimulates the release of dopamine in the nucleus accumbens, the same reward pathway that is activated by drugs of abuse. Over time, with repeated sugar intake, there is down-regulation of D2, dopamine 2 receptors, just like we see in chronic drug users. This leads to a state of dopamine deficiency between sugar hits, which can drive further craving and consumption. So, what about humans? The evidence is a bit more nuanced. Whilst we don't see people robbing banks for a donut, the psychological and physiological patterns are strikingly similar. What researchers call the addiction triad are all present, though often less dramatically than with drugs like heroin or cocaine. Interestingly, people who quit smoking often report stronger cravings for sweets, and oral glucose can actually reduce tobacco cravings and withdrawal discomfort. There's even evidence that for some, the desire for sweet foods can surpass the craving for drugs like cocaine. So, in terms of evolutionary roots, why are we wired for sugar? Why are we so vulnerable to sugar's pull? The answer lies in our evolutionary history. For most human existence, sugar was rare. It was found in ripe fruit or honey. Consuming it meant a quick way to store fat and survive periods of scarcity. Our brains evolved to find sweetness intensely rewarding far beyond our metabolic needs. But unlike our ancestors, we now live in a world where refined sugars are abundant and stripped of their natural content. There's no fiber, there's no micronutrients, just pure, rapidly absorbed crystals. This refinement process is eerily similar to the way cocaine is extracted from coca leaves or opium from poppies. Refined sugar, especially in the form of sucrose and high fructose corn syrup, is rapidly absorbed and delivers a potent hit to our brain's reward system. This chemical-like purity is a big part of what makes sugar so habit-forming. In fact, the more refined the sugar, the more addictive its properties appear to be. Animal models show that sugar can produce all the hallmarks of addiction, not just binging and craving, but also withdrawal symptoms when intake stops. In some cases, giving an opioid antagonist like naloxone to sugar-fed animals produces withdrawal signs similar to those seen with morphine or nicotine. So what does this mean for us as clinicians? Well, firstly, it's important to recognize that not everyone is equally susceptible. Genetics, individual taste preferences, and even early life exposure play a role in who develops problematic sugar use. Second, while sugar withdrawal in humans isn't obvious as with drugs, it may manifest as mood changes, irritability, or even ADHD-like symptoms such as hyperactivity and distraction. There's also a notable overlap in the brain changes seen in obesity, ADHD, and drug addiction, specifically the downregulation of dopamine receptors. And finally, there's the phenomenon of addiction transfer. Some patients who undergo weight loss surgery and previously had issues with high sugar foods may develop new substance use disorders post-surgery. This suggests a shared neurobiological vulnerability across different types of addictive behaviors. The term addiction is traditionally reserved for drugs of abuse, but the lines are blurring. The DSM-5 now includes binge eating disorder, and the same opioid system that mediates drug addiction also drives our cravings for sweet, high-fat foods. Whilst there's debate about whether sugar meets all the criteria for addiction in humans, the evidence from animal studies is compelling, and the parallels in neurochemistry and behavior are hard to ignore. So, what should you take away from today's episode? Sugar can activate the same brain pathways as drugs of abuse. Refined sugar is especially potent in driving addiction-like behavior. Not everyone is equally vulnerable. Genetics and environment matter. Withdrawal and tolerance can occur even if symptoms are subtle. Recognizing sugar addiction may help us better support patients struggling with cravings, obesity, or even other substance use disorders. As health professionals, it is important to approach sugar addiction with the same empathy and scientific rigor we apply to other forms of addiction. And as health enthusiasts, being aware of sugar's powerful effects can help us make more informed choices in our own lives. That's all for today, folks. My name is Dr. Ferghal Armstrong, and this has been Cracking Addiction.